Hi, I'm Jerry Hesch, and I'm teaching a workshop to a group of physical therapists and a chiropractor in New York. And I just treated Angie, and I treated her ankle, and it made a big difference in her sacroiliac discomfort. So I want Angie to tell us what happened.
Hey, I'm Angie. I just remember I had a deadlifting injury, and since then I have on and off pain on my right SI joint. So I'm not aware that I have some issues on my ankle, and today we did the lab. My partner Dorinda found out that I got a lot of limitations on my right ankle, so I volunteered to be Jerry's patient. He also checked on my neck and found out that my C1?
C1.
C1 is not moving well. So he checked on me and he treated me. Then after that he asked,
And what did I treat?
You treat my cuboid. You made my cuboid happy, was not moving.
True.
And then, was it my fibula?
And I also treated the fibula head. Fibular head, I mobilized it anteriorly, and then I treated the subtalar joint in abduction or external rotation.
Yes.
And so after that, carry on.
All right, after that, he asked me to stand up and walk around the area, and seems like it feels like my hip is moving well. I don't feel that restriction here on my right side, because I remember one time, like at my CrossFit gym, someone took a photo of me, and then my friend who's working as a physical therapist said, "Oh, you look so great, you look so strong. What happened to your right pelvis?"
Yeah. Well, turn around and show us where you felt tight in the pelvis.
Oh, it's like the photo shows that I was doing something on overhead.
Yeah.
It's rotated forward.
You were rotating
and
the pelvis.
I usually have on and off.
Turn around so they can see where, please.
Like
So you have pain in the region of the SI joint.
Yeah.
Okay?
It feels great after doing
Now you
some
feel
work.
freer, right?
Yeah.
So the moral of the story is that sometimes when you have sacroiliac restriction, if there's a restriction in the foot and ankle, treat the foot and ankle, because the sacroiliac restriction or hip restriction might be secondary, not primary.
Yeah, and after
And what
that
else? What
you check.
happened to your neck? What did you find in your neck?
So after that, Jerry checked on my neck and it's moving freely.
Yeah, we found you were restricted at C1. C1 had reduced rotation, and it had reduced side glide to the left. So it was rotated right and side glided to the right, and it didn't go freely the other way. But I didn't touch your neck after that. We unlocked the ankle and the upper cervical unlocked.
And because sometimes I would check that on the mirror. It's like, oh, it's not rotating well, because
Ah.
I'm doing a lot of overhead thing. That's why from time to time I would check myself in front of the mirror. It's like, oh, it's not.
So you're aware there was something going on?
Yeah.
Yeah. Well, good. So I'll teach you how to treat the ankle yourself, and so it'll be a one-time correction.
All right.
All right? And it's a good example of the whole body approach. Again, to recap, where she had restrictions in her subtalar joint and in her cuboid and fibular head, and that caused a secondary rotation up in the upper cervical spine, and it also caused her to have tightness in the sacroiliac region. And the sacroiliac and the neck released spontaneously when we restored the motion in the foot and ankle. Thank you very much.